Hey guys, Johan Latte here from the University of Nice. Like before, I will try to replicate one of the presentations I've had, and this time at the Modern Science and Practice for Strength and Endurance Training International Symposium 3 days ago about as to the University of Jyvaskyla. This is my old uni where I did my master's thesis, and this data is based on that, but there will be some unpublished data also in this presentation. We titled it, Does Barbell Back Squatting Only Provide Vertical Stimuli for Athletes? The Effect of Widening the Stance at Femur Parallel Depth on Vertical and Medial Impulse and Hip and Knee Kinetics. So most coaches would agree that squatting is considered a preparatory exercise for sprinting-based team sports. But what's argued about is its relevant inter or intramuscular stimuli and the transfer it produces to injury prevention or performance. So let's have a look at common arguments or anecdotes for the specificity of back squatting. We can see this common comparison between the hip and knee and also the ankle angles in athletic maneuvers and squatting. And especially when we rotate that image, it looks even more attractive, portraying the possible similarities in triple extension mechanics. In terms of intramuscular stimuli, this is quite well established where squatting has shown high utilization of such muscles as erector spinae, glute max, vastus lateralis, adductor magnus, and all of these muscles have been associated with sprinting speed. Here we have erector spinae cross-sectional area associated with sprinting speed in team sport athletes. And here, in a comparison on the y-axis between high-level sprinters, cross-sectional area, lower body muscles, and non-sprinters on the x-axis, the muscles that differed the most was the glute max and vastus lateralis, conveniently, and also not far behind the adductor magnus. So now for some arguments for the non-specificity of back squatting. In a dynamic squat pattern in different directions, so let's say jumping up or even backwards and then jumping forwards, we find that in studies have shown that the more we jump forwards, the more the hamstrings activate. Now this makes sense in terms of their role in directing force and how the importance of the hamstrings in sprint acceleration. And also it makes sense why there has only been found low to moderate activity of the hamstrings in the squat. This has also been portrayed quite well by Blažević in 2002, where he compared squat strength in a vertical and a lean position in this exact same hip and knee angles. And he only found low to moderate correlations between strength levels. In terms of triple extension, directly when there's braking forces, which for most athletes is past the first step, or even for some high-level athletes at the first step. Not saying that this is the ideal technique, but this is still something that's present, where if there is braking forces, there will be a co-contraction at the knee to rotate over center of mass. And once we've done this, we will start extending. And therefore the triple extension is a bit different, or I would say in this point substantially different in the squat compared to sprinting. So this picture becomes slightly invalid, to say the least. Other relevant topics, movement velocity, pre-activation or slack that Bosch likes to talk about, MTU adaptations, other planes. Now, bilateral deficit is also a good one, although we should remember that once that's accounted for, these same limitations exist. So in summary, there may be an overestimation of the value of the vertical force stimuli for transfer. However, from a preparatory standpoint, can we improve intramuscular stimuli with increased stance width? Previous literature has shown increased EMG activity of the glutes when we go wider and while maintaining the same quad activity. But this has only been done in absolute loads, and the only studies comparing relative loading is studies comparing depths. different depths, not widths. But the question then becomes, are we sacrificing the vertical stimuli by going wider? And what happens to the net joint moments at the hip and knee, the main extensors in the squat, and does the movement become more hip or knee dominant? I should mention that these are common coaching terms again. What's taking place in the frontal plane is also a question. Therefore, we asked at the hip and knee, what is the sagittal and frontal plane cost benefits of widening the stance in the back squat at a commonly applicable depth? So we had 3 weeks of familiarization for 14 male and female rugby athletes. Narrow was considered greater trochanter width, so basically hip width, which you can see from picture A. And then the wide was considered about 50% wider than this, as you can see from picture B. It depended a bit on the anthropometrics, but most people could comfortably get, or all the participants could get comfortably to parallel depth. The tempo was 3 seconds down and explosively up. Week 4, we did 1 RM testing for both widths. And although there was individual variation, as you can see, interestingly enough, the averages tended to be the same at 1.3 times body mass. Testing day, we had 2 reps averaged at 70 and 85% of 1 RM. Measurements, 7 Vicon cameras and 2 force plates. Net joint moments and kinematics were taken for the hip and knee, and EMG was taken from vastus lateralis and glute max. And for your convenience, I just highlighted everything green that passed the post hoc threshold. All right, in terms of results, kinematics first. Now, in this presentation, I will only show the 70% of 1 RM due to it was so similar to 85%. There on the ascent phase, or you can see the start of the ascent phase at this line at the 75% mark. Now, in terms of hip flexion, there was no differences, but in terms of the knee flexion, it was statistically larger in the narrow squat. Now, in terms of frontal plane, the hip abduction was larger quite logically in the wide squat. All right, let's have a look at the kinetics. First, the sagittal plane. So, interestingly enough, and contrary to previous literature, the hip net joint moment did not differ between the widths. And in terms of the knee net joint moment, this was in line with previous literature where the narrow squat had a statistically higher net joint moment at the knee. Now, if we look at the hip to knee net joint moment ratio, which is a divide between the peak hip and knee sagittal net joint moment, we find that the wide is statistically more hip dominant with a large effect size. And now let's have a look at the frontal plane. So from the video, you can start to see the behavior of the force vector in the narrow and wide in the ascent phase. Basically, this helps to understand what's going on at the hip and knee. There was no statistical differences actually at the hip, so for hip abduction. But in terms of knee adduction, the wide was statistically or had a statistically larger knee adduction moment. Now, what this means in practical terms is that you're fighting harder to avoid knee collapse in the wider squat, which instantly maybe many can think of scenarios where that might be beneficial to overload in terms of injury prevention. Then we asked, because impulse is an important factor in strength training, how does this impact the impulse medially and vertically? We did a ratio again between the medial and vertical impulse this time, and ratioed it to 100 so you would get a better idea of the contribution. And this turned out to be so that the wide had a twice as large contribution of the medial impulse, up to 25% in fact, with a large effect size. The following image will visualize this quite well, hopefully. Basically, here is the force vector behavior in the ascent phase of the squat. In the blue, we see the wide, and in the red, we see the narrow. Number 1 is the start of the ascent phase, and 2 is the end. Now, vertically, it doesn't seem to differ too much, but medially, it does. Now, this turned out to be so that when you go wider, in average, there's a vertical impulse sacrifice of 2 to 4%, but an increase in the medial impulse by 80 to 85%. We had some issues with the bipolar EMG, that's why it wasn't in the publication, but I would say luckily enough, it corresponded with previous literature with the vastus lateralis activity being the same and glute max being higher, albeit only the 70% load. Now, the question then becomes, we had less net joint moment at the knee in the wide, but more activity the same activity in the quads. So this would technically reduce the hip dominance in the wide. But this would be then countered by the knee adduction moment that was higher in the wide because there's no muscles that do knee adduction. So this would be increased work at the hip. So to conclude, at femur parallel, while using the same relative load, wide seems to maintain potential for similar vertical stimuli while increasing medial lateral stimuli, or easier and put in a more easier way, increases medial stimuli, to be more specific. Wide increases hip to knee net joint moment ratio. And the takeaway message becomes, or as my old professor put it, Dr. Ahtiainen, so what? At the hip and knee, the biomechanical benefit of widening the squat stance seems to outweigh the cost. Questions for future research. Does widening the stance provide alternative and relevant, should be emphasized, longitudinal stimuli within and outside of the sagittal plane for sprint-based team sports? So we have 3 studies looking at the different depths, but no study has looked at the long-term effects of widening the stance. So as a little joke at the end, there might be more to the story outside the side view. Plenty of limitations. We didn't compare to athletic tasks, assumptions from net joint moment EMG, and didn't compare with depths and different widths. And other large muscles, we had plans to do EMG from 8 muscles, but we had, like we said, issues with the EMG. Lumbar and ankle net joint moments can be actually found in our publication, so go check that out if you're interested. I would like to thank hugely my co-authors. Without them, I couldn't have made this so interesting. Not even close. Andres Hagi is publishing, by the way, a lot of interesting research now on hamstrings, so go follow him. Andrew Vygotsky is a genius, so go follow him too. If you're more interested in our publication or this theme, you can go read our publication in Scandinavian Journal of Medicine and Science and Sports that was published about a couple of weeks ago. Juha Ahtiainen, if you see him, go tell him that get on Twitter. I would also like to say a quick word about Professor Pavel Komi, who passed away about 3 days ago. His influence on my thinking has been huge, and probably for anybody in strength and conditioning, he's had a huge impact in our field. So I was very lucky to meet him one time only, and we'll look forward to his contribution in the upcoming years. Here are the references. Thank you for your attention, and please do ask me on Twitter or any other place for more information.